So hello, everyone. First of all, thank you so much for coming here today. So as Petra mentioned, we're going to be presenting one type of services that we offer at TEF-Health, which we call the physical services. First, just to introduce myself, my name is Núria Vàzquez Salat. I am team lead at Vàzquez Innovations, which is a consultancy subcontracted by Umani, who is the TEF-Health Physical Services Coordinator. Next one. So the way we're going to structure today's webinar is we'll have a bit of an overview of TEF-Health, and then we'll go a bit in depth on the different types of services, particularly the physical services, which is the topic of today's webinar. We'll follow this with some case studies from my colleagues who will show you how our physical services have already supported SMEs in reaching either certification or actually advancing their TRL. And finally, we'll have a bit of a tutorial, a bit more practical, on how you can access our services, how you can look through our services, and how, if applicable, you can apply for discounts in our call number 2, which is international. We'll have a Q&A, and at the end, if you have questions, we'll stop on each block to make sure if there is some really urgent pending question, feel free to answer them. The next. Okay, so let's start from the beginning, why we're all here. So as you know, the EU has developed the first comprehensive framework to regulate the AI, It's the AI Act, and it aims to balance innovation with actually protecting European citizens from any possible harms of AI. Now, the AI Act entered into force August last year, but it will be fully applied in August 2027. What is interesting is that it set up a structure to assess the validity, security, traceability, and trustworthiness of AI solutions in any solution that enter the European market, whether they have been created in the European Union or they have been created outside. If you go to the next. The core of the AI is the risk-based AI classification, which, as it makes sense, the higher the risk, the more compliance. Now, under this classification, any medical device that uses AI solutions is classified as high risk. This is obviously because we have patients' data. The European Commission is fully aware of this and is aware that it might cause some burden, particularly on the European industry and SMEs. And for this reason, it created the testing and experimentation facilities under 4 key sectors, one of them being health, and is the one that we're going to be covering today. Now, just these initiatives are meant to support AI innovation from SMEs that are based in Europe to fast track them towards the EU market. The European Commission is definitely committed to ensure that there is a high growth on the high-tech sector. And as President von der Leyen mentioned it in herself, I want the future of AI to be made in Europe. So if we go to the next. So here we are, the TEF-Health. These are the testing experimentation facilities that support SMEs in TRL 6 to 8 that work in the health sector and have a solution that is either AI or robotics. So you can see on the map on the left that we have 9 participating centers, a total of 52 organizations with more than 300 professionals, all of us together creating a portfolio of 342 services, with a single aim to make sure that Europe is at the global driving seat of AI innovation. We go to the next. Why is TEF-Health different? You will see during my presentation, but we have access to a broad range of technical, regulatory, and clinical expertise in a single platform. You will also have broader impact. As you have seen in the map, we have 9 participating member states, so you can move your solution from one market to the next. We have seamless TRL advancement. As I mentioned, we focus on TRL 6 to 8. However, we have structured our services to make sure that you can reach the market faster. And finally, but not least, we want to mention the network effects. So we are a network, but obviously each one of the partners has access to their national networks. So your impact can be to the type of stakeholders you can reach, it can be much higher. You can go to the next. So here it is, the TEF-Health, the 52 partners. We have a broad range of services and we have structured them into 3 categories. So we go to the next. These are physical, virtual, and consulting. As I mentioned in the title of the webinar, today we're going to be focusing on the physical ones, but please be aware there's going to be a webinar for the virtual and another one for the consulting. In addition, we're going to have a webinar on the 26th of November, specific for any SME that has robotic solutions. So if you know somebody or you feel it can apply, please make sure you sign up for this webinar. It'll be advertised soon. Now, the physical services, what do we mean by the physical? As the name intuitively mentions, these are the real testing facilities. It can include the lab base, it can include the hospitals, it includes the imaging facilities, the clinical trial units, anything that has the physical component. If we go to the next. Here are all the 21 partners that have physical services that are being in offer for the SMEs. Do not be concerned in trying to memorizing those names. We'll show you afterwards where you can reach them in the database and when you can take a bit more on the in-depth look. But we want you to see is the variety of institutions that are coming together. And we have pool services, if we go to the next, that can be grouped, that can be grouped into these 6 categories. 3 of them belong to the data acquisition. There is the simulated environment, the real-world environment, and the clinical research services. Now, in this webinar, I'll be explaining each one of them a little bit, so we can go into detail and you can see the breadth of services that we offer. The data acquisition services have been subdivided into 3 subgroups, but they all refer to services that we offer in an unrealistic and controlled environment. This is more like a lab type of environment. So you can see the first category is the testing facilities, and we can have a broad range of services from sleep monitoring, automatic nervous system, psychosocial. It's a full variety. And you can see on the right all the partners that offer these services and between brackets the country. So you can truly see the internationality of TEF-Health. If you go to the next. As the name implies, the imaging facilities are obviously facilities that are offering imaging services. And you can find on the right the type of all the partners that offer these services. And if we go to the final one on data acquisition, is the omics on bioanalysis. This is the classic molecular laboratory. We can have service from single cell analysis, but we also have metabolomics, medical chemistry, including the biobanks. And we have on the right the partners that offer these services. So these 3 categories are the data acquisition. Then we move to the next, which is the simulated environment services. These are services that are in a realistic yet controlled environment. We could understand this a bit more like the fake rooms where they perfectly mimic how an A&E room looks like, how a maternity ward, how a nursing room would look like, but they are not the real one, the hospital one, should we say. But you can see on the left the full range of simulated facilities that we offer, and we have on the right all the partners that serve for them. We move to the next. So after the simulated one, the logic step is the real-world environment, which obviously we understand it as hospitals. These are services that are offered in a realistic, completely uncontrolled environment, and there are accesses to our SMEs. We can see here the 3 hospitals that offer these services, and on the left, the type of services that they offer. The final category is the clinical research services. Now, what we refer for physical clinical research services are the services that support the testing of AI solutions in a clinical investigation. So you can see on the right all the different partners where you can undergo a clinical investigation should your solution need it. And we have on the left the classification of the services. And you can see that they are very much mimic the CRO type of nomenclature, so it's easy for your SME to understand what your needs. So we go to the next. So as a summary of the first section of this webinar, I would just want to say that we have, as you have seen, a total of 193 physical services. These are grouped into the data acquisition, simulated environment, real-world environment, surrounded obviously by the clinical research services. And this is obviously meant to help your solution be moving forward from TRL 6 to 8. I hope you have seen the breadth of services and the diversity, so we're pretty confident that no matter what your solution, we have an expert in our platform that can help you in reaching the market faster. And again, because of our international setup, you can really move smoother that would normally be in the European Union through different markets. So this is actually a first introduction on how we structure our physical service. We're going to be moving to the case studies, but it would be nice if any of you has a question on a bit more on the general one. We're happy to answer them. If not, we'll go into the final Q&A. Okay, so if we have no questions, then I'm going to pass it to my colleagues who will show you how the different services, their physical service, have been able to help SMEs in moving their solution towards the market. The first one is going to be Fau from...
Yes, hello, my name is Türk, and I am a TEF-Health member of the Friedrich Alexander University in Erlangen-Nürnberg. Today, I would like to share one of our recent case studies with you. The B-Medic company is a global supplier of mental health equipment, such as EEG and ECG devices. They also develop software to analyze data from these systems. And in the past, B-Medic reached out to us to validate an AI model they developed for respiration tracking using RGB and infrared camera footage. As some of you might know, breathing patterns can reveal valuable insights into stress levels. With this model, B-Medic aims to estimate stress non-invasively, without the need for contact-based sensors. Our task was to compare their AI models' result with a gold standard method for accuracy and reliability. Next slide, please. To evaluate their model, we designed a mini game for study participants. You can see the setup here on the right. Can you click on the video at the bottom? Yes. So as you can see in this game, the participant moves their head by tracing a fixed path with the nose. And at the same time, they follow a guided breathing pattern, such as inhaling and exhaling at specific intervals shown on the screen. This setup allowed us to observe the AI's performance at different head angles and lighting conditions. Meanwhile, a respiratory belt tracked the actual breathing patterns as a reference. At the end of the study, we provided B-Medic with both datasets from the model and from the belt, along with a detailed performance comparison. And this helped them refine the algorithm and move closer to integrating non-contact stress tracking into their product line.
I'm Alessandra Pedrocchi from Politecnico di Milano. It is my pleasure to present you our pilot service that we delivered to a spin-off of our lab for helping the spin-off to go to the final documentation for certification. The product is a motorized 4 degrees of freedom exoskeleton to be used for individuals with severe impairments of the upper limb. So they turn to TEF-Health to support the CE marking process of the final product. Next, please. And what we were mainly asked is to help them in the clinical validation by doing a literature analysis and analyzing the device. We supported the selection of the device classification in class 1 medical devices. And in the clinical validation, we did a literature comparison. We validate clinical data and we documented the equivalence of their product with a product already published in the literature and validated. Next, please. And finally, we produced a final documentation of documenting the equivalence between the product and the device published in the literature and validated in the clinical literature. That's all. And that document was included into the certification documentation. Thank you.
Okay, thank you, Alessandra. Okay, my name is Carlos Beltran, and I will present it on behalf of the TEF partner Italian Institute of Technology. This use case is very similar to the one you, Alessandra, presented. So it's the same use case. We have an internal spin-off that is starting to be created. They wanted to have help on how developing, let's say, a business plan to include differentiation or a pipeline to differentiate themselves from the competitors and things like that. So create more value to their products. So they are a spin-off that creates a lower limb processes, and they are trying to figure out a way to provide a better service to their customers by making longer the rehabilitation period. So the time that the person adapts to the lower limb prosthesis. Those prostheses are intelligent in the sense that they can adapt and tune their internal control loops. So they may have use of data that help them to adapt to the user. So the problem they have, or in general the market has, is that the rehabilitation phase that is done by those users is very short, because they need to use high-level laboratories or clinical setups to tune the prosthesis. So after this period of time that is very short because it needs the use of these costly labs, then they go home and they are, let's say, left alone. So they cannot close this training with the prosthesis. So this produces strain, body disalignment, the adaptation of the user is not very good, having high consequences to the user. So the user feels that the product is not adaptable to him, it is using it incorrectly and things like that. So next slide, please. So what we propose, so our service provides a series of intelligent sensorized environments that provides low-cost environmental sensors and also low-cost wearables. With this data, we are able to provide a stream of data that can help both the user, the clinicians, and also the engineers developing the device to adapt better the product to the user. Next step, the next slide, please. So conceptually, the environment, it is depicted in the picture on the top left. So you can think about sensorizing an apartment, also a private apartment, but in many cases it can be also a simulation of the apartment in a hospital or in a clinic. And those sensors are used to provide this stream of data that can be used to improve the performance. So it provides insights to the amputee, the clinicians and engineers, and then helps to fine-tune the processes to the actual user. So we are trying to make longer the process of adaptation to the new processes. So this will increase the user comfort, it will increase also the user acceptance, and it will provide an important added value to the customers of the company. Thank you very much. This was all my presentation.
Hello everyone, I'm Jean-François Piche, leader of the embedded and telecommunication teams from Multitel Research Center. I will talk about electromagnetic compliancy pre-testing. So Cortex Machina developed an electronic device for EEG monitoring, which is a kind of helmet which has to be installed on the head of the patient. So as it is an electronic device, it has to follow the European directive for EMC compliancy. So they have to test their system as soon as possible. Their needed is time to market consideration, and they must be sure that the tests are okay. It's very important for them to do some pre-test, because if you have some failure on the test, you have to redesign partially the electronic part of the system, and it could take times and many times. So it was very important for them to provide some pretest for risk mitigation, for time to market, and to reach CE marking for their TRL 8. So we help them to, first of all, define which standard has to be tested for their system. It was something very important for them because in the European regulation for electromagnetic compliances, there is many standards and you have to navigate in this standard. So first thing for them, help them to identify which standard has to be tested. And after that, next slide, please. We provide them test, radiated and conducted emission for immunity also. And we provide them the result of the test 1 month later. It was very important, this idea of 1 month, and hopefully for them, there is a success on the test. But if you need this kind of test, what is very important, we can help support. We can redo as many times the test to help to diagnose what are the problem, and we support with EMC engineer expert to help to imagine, to define a solution if there is any problem. So finally, for Cortex Machina, it was a success because they reached their delay for the time to market, finalizing CE marking, and to be able to sell their product as soon as possible for them. Thank you for my part.
Hi everyone, so my name is Antonio and I'm here to tell you about the pilot that was conducted at the local health unit of Coimbra. This piloting was about a solution called DocPort, which is developed by a company called Verticare Systems, and is basically a speech-to-text technology that, with the use of AI, automatically transcribes what is being said in a consultation. This was implemented in one of our many primary healthcare units, and it was with the help of a reliable doctor that has been collaborating with us throughout this TEF-Health project in many initiatives. And the doctor was the one that was in direct contact with the company to provide the feedback on the usage of the solution. Regarding the services, including the category of the rural environment, and the one performed was a usability testing. About how DocPort works. Basically, at the beginning of every consultation, the doctor has to first select the module that is more adequate to the consultation is about to perform. And after doing so, he can simply press the start recording button, and then throughout the consultation, the audio is automatically transcribed in the background. After the end of the consultation, the doctor only has to stop the recording, and after a couple of seconds, a clinical report is generated with the use of AI that basically summarizes the main takeaways of the consultation. The doctor then had to only validate this output, and if everything was okay, he could copy it to our EHR. It's important to notice that after every consultation, both the audio and the output generated was automatically deleted due to security reasons. Next slide, please. During this trial, and as I already said, the doctor was constantly providing feedback to the company. These ranged from things such as changes to the interface that he thought that it would be more suitable, the structure of the output generated that could be more aligned to the one used for his consultations, as well as, for example, certain terminologies that could be more aligned to the medical language. Using all this feedback, the company was able to improve and refine the models as well as the interface. The main takeaways we can take from this pilot is that by using solutions such as this one, there was a reduction in the time spent on the administrative tasks, so the doctor could be more focused in providing the care to the patients. So we can say that there is an improvement in their experience. Thus, we can say that this was a successful collaboration between the private and public sector in digital health. Regarding the maturity of the solution, it started with a TRL of 5, but by testing in this relevant environment, we can say there was an increase to a TRL of 6. This is just one of our service, so then feel free to see what we have available in our catalog, and if you want to collaborate, please register for call 1. Thank you.
Hello, everyone. I'm pleased to introduce the ODS project, which stands for Optimized Diagnosis of Sarcopenia using AI-powered processing. This initiative began as a collaboration between Grenoble-Alpes University and the Grenoble University Hospital under the leadership of Professor Cécile Bétry. And the goal was to support physicians in the diagnosis of sarcopenia, a condition involving the progressive loss of muscle mass, by automatically determining the muscle surface index, or MSI, from CT images. So to achieve this, the research team developed AI-based algorithms capable of detecting and quantifying muscle surfaces directly from medical imaging data. The results showed strong clinical potential, helping clinicians assess muscle quality more objectively and in less time. Building on this success, the team decided to go further, turning this research prototype into a medical device software ready for clinical deployment. The next major step is to obtain the CE marking, and at this critical transition from research to industrialization, our team, the Clinical Investigation Center of the Grenoble University Hospital, joined the project to provide the human factors and usability engineering support. Our mission was to help guide the software development towards regulatory compliance and clinical usability. Next slide, please. So our main role was to ensure that the software design truly match the needs and workflows of its end users, mainly radiologists and physicians involved in diagnosing sarcopenia. So we began by working closely with the project manager and the clinical team to define the use specifications, so the intended purpose of the software, the intended users, and the specific hospital environments in which it would be used. And this step built a shared understanding of the product's goals and created the foundation for the usability engineering file, which is a key deliverable for CE marking. And once the use context was clear, we organized co-design sessions with the medical and technical teams, and together we explored and compared different user flows, mapping how a clinician would interact with the system, from importing CT images to validating the MSI results. Through all these workshops, we identified the most intuitive and efficient workflows, ensuring that the software fits naturally into clinical practice. And then I, the ergonomist, created mock-ups of the interface, which became valuable tools for discussion. They helped align developers, clinicians, and project managers early in the process, making design decisions visible, testable, and easy to refine. In parallel, we contributed to the risk analysis, identifying possible use-related errors, such as data misinterpretation or wrong image selection. We then proposed design improvements to reduce these risks. So all this work, from user research to risk mitigation, helped prepare the usability engineering file and set the stage for upcoming evaluations. In summary, the CICIT of Grenoble helped transform a research prototype into a pre-industrial medical device ready for clinical validation. By integrating ergonomics and human factors early, we ensured that ODS is safe, compliant, and truly usable for healthcare professionals. Thank you for your attention.
Hello, everyone. My name is Tobias Zech. I'm project manager at the Fraunhofer IIS. I will show you a couple of case studies that we had in the past, where we evaluated certain ML algorithms, AI algorithms in medical products. This is a company called Hamburger Medical, which didn't exist before they contacted us. They were known for manufacturing actually bath appliances, and they wanted to develop a new medical product in which they want to enable at-risk patients to monitor their health status, cardiac health status with a low barrier device, in this case an ECG integrated into a toilet seat. And one core element of this was an algorithm detecting heart arrhythmia. They contacted us at a very early TRL, but I will show you, because TEF-Health starts at TRL 5, the path they took with us from TRL 5 on until they reached the market entry. They wanted to access certain facilities, services we offered. For instance, we have a cardiology lab with a state-of-the-art devices, which we offer in TEF-Health. We provide a feasibility study, connected them to clinicians in which they could do their feasibility and their clinical study in the end, where we provided a data management system and also supported them in the scientific communication and scientific documentation for the clinical study. In the end, we were able to reach market entry with this device. It's a Class 2A medical product now, can be used in any kind of clinical setup or nursing home or for patients at home to evaluate whether they currently have some sort of heart arrhythmia. Next one, please. This was a company called HypnoVR. They contacted us because they wanted to develop and evaluate an algorithm to see anxiety in patients that were in care during some sort of dental procedure. HypnoVR is a device where they want to minimize anxiety by stimulating the brain with some simulated environment, reducing any kind of anesthesia, medical anesthesia. And our job was because normally they express the anxiety via vocal commands. They were not able to do this during dental procedures, to have some sort of multimodal biomedical feedback. This was primarily also a digital service, but also part physical service. This we were also able to reach market entry. They, as far as we know, didn't choose to integrate this in their product in the end, but in theory they could. The next one, please. This is a company, a startup from Germany called Sonovum. During any kind of brain injury or brain trauma, they are developing a device with a sophisticated algorithm to evaluate the brain pressure non-invasively, non-invasively essentially. So we provide them also with certain offerings and solutions. For instance, feasibility study with our close partners here in Germany, in Erlangen, the University Clinic of Erlangen. And we also help them with ethics and scientific communications We provide them a multimodal biosignal lab where we can measure several different biophysical signals, and also help them with another service which we probably offer in the future, where we help to improve their algorithm. This project is still ongoing. They reached us also at a very early TRL, but we're now at TRL 7 and hope we will reach market entry sometime next year or in the next few years. Thank you for your attention.
Okay, so we hope you have seen here some real practical examples of how we can help the different SMEs in advancing the level. You have the contact details of all the speakers for the different case studies here. If you have a general on the physical services, you can contact the email from Umani. And if you have general inquiries, you obviously can contact the general TEF-Health European email. If you go to the next. As a summary, we hope you agree with us that we definitely have a broad diversity of services that are available at TEF-Health, and we can help you in reaching the certification faster. Also, we want to mention that TEF-Health is a key player in supporting Europe's strategic leadership on AI. So we are definitely, this is obviously going to be a core of expertise, and we're going to be playing a bigger role as the AI Act comes into fully force. Finally, just as a final one, obviously, that our services are specifically oriented to helping AI developers to bring their solutions to the market under the AI Act. So before we move into the last step of the webinar, which is a bit the tutorial, I wanted to know if anyone has a specific question that they want to mention on the case studies that they want to ask specific. If not, we're going to go into the tutorial.
Okay, thank you very much, Núria. And the tutorial is about how can you access actually all these nice services that you have just seen. My name is Petra Ritter. I am a professor for brain simulation at the Charité University Medicine in Berlin, Germany. I'm also director for international affairs, and I'm leading the European Testing and Experimentation Facility for Health, AI, and Robotics. So if you're interested in all these services that you have seen, or even more services, you can go to our website, tefhealth.eu, and we presently offer 2 open calls where the services can be accessed at discounted prices using state aid. And for this, the process needs to be transparent and democratic, and therefore we have developed a platform where you can, as a customer of TEF-Health, provide all the details that are necessary to access these services. There's also the possibility to go without discounts. So this is a faster process, which is also available via the TEF-Health platform. And in the following 5 minutes, we will give a quick demonstration of the platform to make it easy for you to navigate it and to access these services.
Welcome to the TEF-Health portal. This guide will demonstrate how to browse services, apply for discounted support, or submit a quick direct service request. We commence with registration. Enter your work email, set a password, and verify your email by following the confirmation link we send. Upon logging in, you will land on a dashboard composed of various cards, each serving as a shortcut. The card labeled Request TEF-Health Service opens the Service Explorer, which functions as your catalog. Within the Service Explorer, the left sidebar contains filtering options, a search box at the top, followed by discount calls, if applicable, category toggles, physical, consulting, virtual, service type, country, provider, and offerings. Utilize these filters to narrow down the list. On the right, you may switch between card view, a sortable table view, or institutions. Clicking any service card opens a detailed modal displaying the logo, pricing, operational information, and options to select or bookmark. Close the modal to continue browsing. Select multiple services if you intend to submit a discounted application. When satisfied with your selected services, click the Apply for Discount button that appears, which opens the application form pre-populated with your chosen services. The form guides you through inputting company and contact information, product basics, readiness level, TRL, service requirements, data needs, eligibility checkboxes, and consent areas. You may save a draft at any point. Once all information is complete and accurate, apply for review. For a single service at full price, return to the Service Explorer, select the service, and choose Request Service. The expedited form is concise, requesting organization, product, contact details, and confirmation. Submitting the form creates the request instantly. Track the progress of your requests by opening the My Service Requests section. Discounted applications are organized by stages: draft, submitted, under review, and accepted. Fast track requests display their own status line: draft, submitted, accepted, or rejected. Clicking any entry reveals its details, messages, and, if permitted, the option to add more services. Once a request is accepted, delivery and follow-up are managed within the service overview area, where items are grouped by operational status: planned, in progress, or completed. This separation ensures clarity between execution and intake. If assistance is needed, each record includes an Ask a Question button for contextual support. A help desk section is available for addressing broader concerns. In summary, utilize a discounted application when seeking financial support for multiple services, or opt for a fast-track service request for direct provision. Register now and explore our services for testing and validating your AI solution at TEF-Health.eu.
Yeah, thank you very much. If there are any questions, it is always possible to go to the website and to use the help desk that is served by our entire consortium. And with this, I stop sharing my screen. I hand it over back to Núria to give you now a live demo of our service portal that is publicly accessible. It's your floor, Núria.
Okay, hello. Can you confirm that you can see the website?
Yes.
Okay, good. So anyway, now you have seen all the mechanism for call to, but actually, if you want to learn a little bit more about the website, you can go on the website and learn a bit more about us. But the two buttons that should be of your interest is search for service and apply for discount. Now, when you search for service, it will direct you to what we call the knowledge graph, which is a database with all the services from TEF-Health. There, you can actually see them based on the service, the organization that's offering them, or actually the country. So for example, if you click Belgium, you will see all the different partners that offer services in that country. So we can go to Mani, the coordinator of the physical service, and you can see a list of all the services that they offer. You can also access a bit of information on the facility in itself. Now, if you look at the services and you want to look for the physical services, which is what we've been talking today, so hopefully you'll be able to look at them, you can actually go here and click at physical services, and it will be offering the different services. Then you can be searching by here or by the different offerings categories, which should help you to narrow it a little bit down. Now, here there are the different services, just to mention that not all of the partners are able to participate in the call. So for example, we have here the Fraunhofer, which is a partner that has presented that is not able to present. Also, FAO is not able to participate in the discounted. In this case, what you would do is you would look at the different service, you would look at the email, and you would contact them directly. However, if you want to access for the discount, as Petra mentioned, we need to provide a very clear, transparent process, and we have right now 2 calls open. The way you would be accessing for the discount is apply for discount button, and you would have, again, as Antonio mentioned, the call 1 for the Portuguese TEF-Health Services, or the call 2, which you actually have just seen the little webinar on how to access them. So we hope to see you soon, and we just would like to know if you have any questions, and we're happy to answer them.